to health care. The disease is frankly too much to handle. Joining me now from Bristol, Tennessee is NBC News reporter Joshua Burns. So Joshua, another point on that 13 million confirmed cases. It took us only 6 days to get from 12 million to 13 million cases. That shows you how rapidly the surge is moving across the country. Tell me what you're seeing, what you're hearing in Tennessee. How are they doing with this?
Well, Katie, infectious disease experts I've been talking to here tell me that they have been preparing for the potential of a pandemic for years. What they weren't necessarily preparing for, though, is the fact that many people don't believe a pandemic is happening, even if as it has very much reached their communities. Hospitalizations here have doubled in the last month. And in fact, since we began reporting here just yesterday, they saw their biggest single-day jump in hospitalizations. And yet there are many people in these communities who don't believe COVID is real or don't believe it is as serious as it is and are not taking those preventative measures of wearing a mask and social distancing. And for more on this, I want to turn to Chief Infection Prevention Officer here, Jamie Swift. Jamie, how is this misinformation around COVID-19 impacting what's happening behind the doors of hospitals like this one here?
So we're extremely concerned about the misinformation. What we see is, as patients may not believe COVID is real, they ignore symptoms, they don't take precautions, they don't come in and seek care until they're extremely ill. When that happens, obviously it's a strain on our staff. They're going to end up in the hospital longer, and they're going to need more advanced care.
How concerned are you about the repercussions of what has happened over this holiday week in some households where people were not necessarily seeking the warnings and the guidance around limiting gatherings?
I'm extremely concerned about our region for the next 4 to 6 weeks. As you said, we're seeing our single-day increases day over day. You know, with this burden of virus in the community, with that much potential spread, I'm fearful of what may come in the next 4 weeks.
Jamie, thank you so much, and thank you for all the work you do. And Katie, at this point, the rate of admissions at these hospitals is outpacing the rate of discharge, which means more people are coming in than are coming out. That's putting a strain on bed capacity, but it's also putting a huge strain on staff who themselves are now getting sick. And so the message, as you say so often on your show, wear a mask, social distance, and try to keep yourself and your neighbors and family out of the hospital because there might not be room for you at a certain point. Katie?
I mean, if you don't believe in the virus, just think about whether you're confident that you're not going to get into some sort of accident that's going to send you to the virus. Are you confident you're not going to get into a car accident? Are you confident you're not going to fall and break something? Are you confident that your kid won't do that or your loved one won't do that? Because if you send them to a hospital right now, you could find yourself in a very dire situation where there just isn't enough people. There aren't enough people to help. We certainly saw that here in the peak of things here in New York City. Joshua Burns, thanks so much for joining us. And now that the coronavirus vaccines are moving toward approval, the next challenge will be getting doses to the people who need them. And the biggest obstacle of all is going to be storing them and then transporting them at sub-freezing temperatures. CNBC's Seema Modi files this